Hello, I'm Angelia Buckingham, a first semester graduate student, winter term 2017, in the MLIS program at Wayne State University, bringing you a 5-minute video presentation for LIS6010, Introduction to the LIS Professions, taught by Professor Jennifer Gustafson. During this video, I'll talk about small technologies and how they produce big data and what's the significance to medical information management. So, I hope you enjoy this presentation of Information Management when Small Technologies Produce Big Data in Medical Information Management.
Medical records technicians are like the librarians of the healthcare system. Librarians of the healthcare system. Librarians of the healthcare system.
With today's technological advances in medical treatment and data management, the medical information professional does more than maintain patient files. They utilize faster, more accurate electronic technology, some of which has been made to integrate with personal data tools such as smartphones and electronic tablets. These technologies have also been associated with cost reduction in the healthcare industry. At the federal, state, and local levels of government, the rising cost of services provided by medical professionals continues to climb and has become a cause for concern. As populations rise, the allocation of healthcare dollars will be closely associated with how effective the medical procedures and treatments can become. The system that monitors this effectiveness revolves around information management practices of medical professionals. In an article on the economics of allocation of healthcare dollars, Jesse Romero notes that Americans spend $2.9 trillion on healthcare in 2013. That's 17.4% of the gross domestic product. In 1960, healthcare costs were only at 5%. The Centers for Medicare and Medicaid Services projects that health spending will continue to outpace the GDP, reaching 19.6% of the gross domestic product by 2024. Rising spending reflects the rapid increase in healthcare costs. Daniel Kraft is an oncologist who gave a TEDx talk in Berlin on the technological developments in health and medicine. During his presentation, he explored the new technologies that will become the tools of information management in the medical field. These tools will help to link the patient and the physician in ways that will decrease the amount of money we currently spend on healthcare. Listen as he further explains this.
Healthcare is shifting from one that's been episodic and reactive to an era that's more continuous and proactive.
Organizing medical data using new technology moves the information management professional from these tasks,
Paper and electronic record keeping, filing, and classification systems in order to keep countless patient files in order,
to information management of electronic medical data, identifying more insights related to volume, variety, and velocity.
A lot of the future of medical visits will be mediated by telemedicine. About 6 companies have launched in the last 6 months that are offering sort of online visits directly from your smartphone or tablet for less than 20 euros. And I think a good percentage, maybe 50% of doctor visits or other healthcare visits will be mediated by these apps.
Cindy Compert, co-author of Information Governance Principles and Practices for Big Data Landscape, conducted an online seminar on the topic of big data. A portion of her discussion talked about the importance of identifying personal information versus personal health information. According to a study done by Dr. LaTanya Sweeney at Harvard, 87% of the U.S. population could be uniquely identified using 3 combinations: date of birth, gender, and zip code. With these 3 identifiers being electronically available, it would significantly reduce the need to allocate healthcare budget toward the collection, management, and storage of this data.
So it's a really interesting world where we can start to get continuous data anywhere on the planet. And so this is an example of big data coming to us. Who's going to understand this data? Who's going to analyze it? We'll need to use this in smart ways.
Information management is an important part of business. In the medical industry, new technology means different ways of managing patient data and personal health information. Technological advances have streamlined continuous data collection by linking patient and physician, ultimately reducing costs associated with health care. Small technology does big work in the variety, volume, and velocity of data it manages. This is the big data of medical information management.